Hi, Ben Weinberg from the Bruce Center here today highlighting a very important article that was published in the New England Journal of daraxonrasib in previously treated advanced RAS-mutated pancreas cancer led by Dr. Brian Wolpin at Dana-Farber. And this was a phase 1/2 study of a novel pill, daraxonrasib, also known as RMC-6236, which is an oral RAS-on multi-selective inhibitor that inhibits RAS globally. And in this study, patients were dosed from 10 to 400 milligrams of the drug daily. And the population of interest is the group that got 300 milligrams or less, 300 milligrams being the recommended phase 2 dose. This medicine was toxic. About a third of patients had grade 3 or higher treatment-related adverse events, mostly rash, also diarrhea, nausea, vomiting, mucositis, and fatigue. But it was quite beneficial in a group of 26 patients who had RAS G12 mutations in the second line setting at 300 milligrams. The response rate was 35% with a duration of response of 8.2 months and a progression-free survival of 8.5 months and an overall survival of 13.1 months, which is very impressive in the second line setting where previous large phase 3 trials have median overall survivals more in the kind of 6 to 8 month range. And then in 38 patients who had RAS G12, G13, or Q61 mutations, 29% had a significant tumor shrinkage with a median duration of 8.2 months, progression-free of 8.1, and 15.6 months of overall survival. So while this is a small study that we're eagerly awaiting the results of the large phase 3 study, that was a true second-line randomized study to drug versus chemo, which we know is positive. This study also shows that this drug is quite beneficial, even in refractory lines where most of these patients had 2 or more prior lines, and most patients had metastatic disease at diagnosis. So even for this, what we think of a more refractory group, the drug still has benefit, although with toxicity that thankfully was mostly manageable.